Hey guys, this is Dr. Jay Siddiqui, and I wanted to show you how to align a 3D printed denture in Blue Sky Bio for implant planning. One of the great things about printed dentures is the resin you use can be radio-opaque, so if you take the CVCT with the denture in the patient's mouth, it'll show up in the scan, and instead of using markers, you can just scan the denture and align it in Blue Sky. This denture I used was made with rhodent titanium base. The base doesn't show up as you can see, and I'll have to double check about the Sprint Ray Apex resin if it's radio opaque. I do know that the Onyx Tough 2.0 is. So you can see on the CT the teeth are showing up, and so I'm going to import the denture scan into Blue Sky. Okay, so I got the scan imported, and I'll try the automatic alignment. I tend to find that it's slightly off with the and when it aligns with the denture, so I end up using CT points on the in the model manipulation mode. You can see in the green slices there, it's slightly off. So if you go to model manipulation on the right side, you can see the selecting with the CT points, and this window pops up. And then you can select a couple of points, so I end up doing like 6 of them that are clear on the denture and align them to the CT scan. Alright, and then it aligns it, and once that's done, you can check the outline and the slices to make sure it aligns. Uh, the other great thing you can do with the denture now imported is that you can use the intaglio of the denture as the base for your surgical guide if you want. And so if you click on the selection tool in the model editing, you can select the outside of the denture with the brush and then cut it out. So I'll do that right here. And when I do this, I also rotate it to make sure I capture as much of the denture without getting the intaglio surface. And make the brush a little bit bigger. Right now I'm just clicking the shift button while dragging it. And I'll rotate it so that way you can capture more of the denture, just to make sure it's a nice clean cut. Rotate it one more time. See, I missed a little bit right there. And there we go, and you click cut, and then you get the intaglio surface. And so now you can use this in implant planning and for the guide. And I'll take it one step further, and I'll also import the tissue scan I did intraorally and align it to the intaglio model using points. In this case, I think it'll allow the surgical guide to see it a little bit better than using the intaglio of the denture because I had done a reline, and so there's a bit more extra pressure on the tissue in this case. And using a hard resin like surgical guide resin might not seat as well. So you can see here that I'm going to click on the CT points to try to align them. The best place to start is with the rugae, since it's very prominent in the scan and in the denture. Click OK, and there we go, we got it aligned. And see that the tissue is a little less compressive compared to the intaglio surface. And you can see that it's now aligned to the CT scan.